Hello and welcome to AHA TV. We're honored to have a chance to speak with Dr. Paul Ridker. Dr. Ridker is a Eugene Braunwald Professor of Medicine at the Harvard Medical School, as well as the Director of the Center for Cardiovascular Disease Prevention at Brigham and Women's Hospital in Boston, Massachusetts. Dr. Ridker and his collaborators have achieved groundbreaking milestones in cardiology, including the first evidence supporting the inflammation hypothesis of atherothrombosis in humans, developing the first FDA-approved diagnostic test for vascular inflammation high-sensitivity C-reactive protein, and demonstrating the effectiveness of anti-inflammatory treatments for heart disease. Renowned internationally for his leadership in over 15 major clinical trials, including Jupiter, Cantos, and Zeus, Dr. Ridker has received numerous accolades, including recognition as a Distinguished Scientist of the American Heart Association and election to the National Academy of Sciences. His work has had a profound impact on cardiovascular medicine, and we are thrilled to have him here today to share his expertise and insights. What initially drew you to research cardiovascular disease and inflammation?
As a physician taking care of patients, one of the most important things we learn is that the textbook's not always right. The textbook changes over time. Our job is to figure out what's really the underlying driver of disease, what are the new therapies that biology might tell us, and how do we advance that? My career as a physician scientist has been a wonderful career because I've been able to take care of patients, but also ask some very fundamental questions that have really changed our guidelines. We treat patients today with atherosclerosis very differently than we did 40 years ago. That's what makes this a challenge, and also what makes it very rewarding.
Why is understanding the relationship between inflammation, ASCVD, and CKD an essential research focus?
Our patients with chronic kidney disease and atherosclerotic disease are at extraordinarily high risks of dying from heart attack and stroke. In fact, they're more likely to die from a heart attack or stroke than they are from progressive kidney failure, what they're most fearful of. So our job is to figure out, how do we prevent these events? Now, all of us give lipid-lowering drugs to these patients, but as the GFR declines, as the CKD gets worse, the benefit of lipid lowering is smaller and smaller. What's so interesting is the risk associated with inflammation is getting higher and higher. While you're here at the American Heart Association meetings in Chicago, there's a symposium, Systemic Inflammation, evaluating potential new treatments in the management of chronic atherosclerotic disease and CKD. It takes place here Sunday, November 17th from 3:15 to 4 o'clock p.m. We're exploring several topics. I'll be presenting on, is it time for universal screening paradigm for cardiovascular biomarkers, looking at CRP and LDL as outcomes. Others will be talking about therapeutic issues for cardiovascular disease and inflammation. It's going to be engaging and informative. I encourage everyone to attend.